Hi, I'm Dr. Vanita Rattan. I'm a doctor, but also a cosmetic formulator specifically for skin of color. So today we have with us Dr. Serena Sehgal, who is a cosmetic dentist who's going to be teaching us what you do if you have missing teeth. And there are different options, there are different side effects, there are myths that we'll be talking about, and also the benefits of the different treatments. So if that sounds good to you, give me a thumbs up. Let's dive right in. So if you're not already following us on YouTube, please make sure you subscribe and you hit that notification bell. And you can also follow Dr. Serena Sehgal on Instagram too, which is the Foodie Dentist.
Yes, the Foodie Dentist.
Also on TikTok. Right, so the first question is, what do you do if your tooth comes loose, an adult tooth comes loose, and this can happen really at any age, you know, from a child playing in a playground to, you know, a skiing accident, etc. So what would your first port of call be?
Okay, so there are lots of different options to replace missing teeth. Now, there's basically three options. People think that you can actually put crowns to replace teeth, but you can't. A crown is a cap which sits on top of a natural tooth. So crown is not an option to replace a missing tooth. There are basically three options. There's something called a bridge, there's an implant, and dentures. So I'm going to explain the differences between them. So a bridge is basically, it's an appliance made in a lab, and essentially you slot it on, but it sits on top of the teeth kind of next door. So it relies on the adjacent teeth for support. And it's fixed, so you won't be able to floss or get anything between it. It's like a connected unit. Sometimes it can be a 2-unit bridge, so it can be 2 teeth, or it can be 3 teeth, or it can be a bit longer. But the longer the bridge is, the more complex it is, because if that one tooth, for example, which is holding a tooth fails, the whole thing fails. Wow. So it's difficult to do really long span bridges. Wow. So bridges is one, it needs careful planning. Your cleaning needs to be incredible. You need to be cleaning it, water flosser, something called super floss to clean underneath. You need to make sure the teeth underneath bridges are really healthy. Yeah. So it requires a bit of treatment planning. The next option is an implant. An implant is something that doesn't require any adjacent teeth for support, so it's a single unit and it's a screw. But it is surgery, and you need to have enough bone there, you need to be medically healthy, and there's certain criteria. So you need a 3D scan and a specialist to plan this. So that's another option.
Is that really painful?
It's not painful, but it's more intense because it's surgery, and then there's about 3 months healing until they can make a crown. So it's a longer process, but at the end of it, that is the only thing that feels like a natural tooth.
Oh, really?
An implant is the only thing that feels just like a natural tooth, and you can clean it and you can floss it, and it literally looks like a normal tooth as well.
Right, okay.
So that's why people like implants.
So cosmetically, that's the most appealing option?
You can get lovely looking bridges, you can, but implants will look, I think, the most natural because it literally mimics a tooth.
Right, and I like you can floss around it.
You can floss around there, you can clean around there as normal. It's a really great way to replace a tooth.
Is it more fragile though, the implant tool?
Not necessarily, if done well, but it's definitely the more expensive option.
Okay.
So implants are the most expensive because it involves a specialist, it involves surgery, so it's not an easy procedure to do.
Okay. All right, that makes sense. And then the other option?
The other option is a denture. So a denture is where you've got several missing teeth and it's actually a removable appliance. So you see the elderly wearing dentures because they've lost, unfortunately, many teeth. And so it's something that you can kind of clip in, clip out, but it spans your palate. So it does give you maybe a little bit of a lisp initially, takes a bit of getting used to, but it is something you can take in and out. But an implant and a bridge are fixed, so you can't take them off.
What age do you start losing your teeth? And is it genetic, or is it what
there is some genetic element to it, but if your teeth are more kind of predisposed, then you need to work extra hard. Now, I see 90-year-old patients who have all their teeth.
My grandparents have all their teeth.
That's amazing, really?
There's something, I've got good genes.
That's amazing. You have got good genes. You have got good genes.
I get my teeth from my granddad, who was 89 years old when he passed, and like not on a single tablet, like so healthy.
That's amazing.
Beautiful man.
That's incredible. And you're absolutely right. There's no age where you should start losing teeth. It's not like it's a normal process. Right. It's not like getting wrinkles.
Yeah, okay, so not like
it's not a normal process. It's how you look after your teeth. Your teeth can last 100, 200 years.
Yeah, wow.
Yeah, if you take care of them.
So why would they fall out? What's the mechanism of action for them to fall out?
Good question. So what holds your tooth in is gum and bone.
Okay.
And if you keep the tissues around your tooth healthy, if you clean them well, if you have a healthy diet, then that gum and bone won't recede.
Right.
If it starts to recede and you get gum disease, that can cause gum recession and bone loss.
Right.
And then the support structures around the tooth kind of drift.
Right.
And then the tooth becomes mobile in the bone because there's very little bone.
Oh my God.
So if you keep your teeth really clean, you see a hygienist regularly, you get your teeth checked regularly, you have a healthy diet.
When you say a healthy diet, what do you mean by that?
Okay, so not having too many sugary foods because that can cause cavities, not snacking too much, that's not great for your dental health. Staying away from fizzy drinks, limiting... having lots of fruit and vegetables because you need those vitamins and minerals to protect your teeth.
Yeah.
For example, like vitamin C is really important for collagen, right?
Yeah.
And collagen makes up the bulk of our gum tissue. So all these, what you eat, even things like hydration, that also really helps with your teeth health and to balance the pH in your mouth and things like that. So it is really a 360 approach rather than just buying an expensive dental product to clean your teeth.
Okay, interesting. Okay, so one of Sienna's friends had a little accident in the playground and her tooth fell out, and this was an adult tooth. So what would you do in a situation where a child has lost their adult tooth?
Okay, so in some cases, an adult tooth when they're quite young can actually be repositioned by a dentist. Okay. So if your child, if their tooth falls out, wherever they are, you need to get the tooth and literally drop it in milk. So as soon as you've gone home, put it in milk.
Okay.
And then you need to keep the area quite clean.
Okay.
So ideally rinse with salt water or something like that, and then go and see a dentist ASAP. Okay. The sooner you can see a dentist, the better. The longer the tooth is out of the mouth, the more likely it will die. Right. Now, in some cases it can be successful. We can actually reposition the tooth, and because of the good immune response and the fact that they're young, it can actually seal up on its own.
Wow.
Sometimes the tooth dies, in which case they may need a root canal in the tooth to remove the nerve if it gets infected. And in some chances it could be unsuccessful. But it's always worth a try to re-implant it, but keep the tooth always, put it in milk, go and see your dentist ASAP. Okay.
And a dentist can actually put it back in place. So it's not surgery.
It's not surgery. Right. No, a dentist can reposition it.
Okay, wow. I know. It's already scary enough, you know, with a child just like climbing the monkey bars or something, and then you're just going, oh, this is just like another thing that can happen.
100%. It's scary.
Okay, so say you've got a few different options. Which one has the highest pain levels, and which ones are probably the easiest to manage and to live with?
So the easiest thing to make and the quickest thing to make is probably a denture, because you take a few impressions and you work with a lab to kind of make this appliance, and the patient goes away straight away and they start wearing their denture. It depends with a bridge and an implant. Sometimes, because with a bridge, they have to prepare the tooth on the other, so they have to use a drill and cut it. Now, the more they cut, the closer it gets to your nerve. So you could be left with sensitivity after the bridge is put on. Okay. An implant, because it's surgery and they put a screw in your bone, you do get a bit of discomfort and you do feel a bit achy. So in terms of pain levels, I would say that implants are probably a little bit more uncomfortable than the three options. But long term, no pain, no gain.
Wow, I thought that was just for the gym. Right, okay, so I really hope today helped you, because I think this is actually quite, if it happens and when it happens, it's actually quite a traumatic thing to go through, because you know, you're not used to it and it's so sudden, and your teeth are such an important part of your face. You know, it's one of the first things that you see when you make eye contact. So actually, I really hope today helped you guys. Thank you so much for asking me your questions on my Instagram, which is at Dr. Vanita Rattan. And thank you so much, Dr. Serena, for being with us today. And we have a few more YouTube videos that we're going to be going through for you. So we have a whole dental series for you. Thank you so much for watching, and we'll see you next time.
Thank you.
Take care. Bye.